This program is made possible by a grant from the National Institute of Environmental Health Sciences.
Se siente, las trabajadoras están presentes. Se ve, se siente, las trabajadoras están presentes. Sí se puede, sí se puede. Vamos, gobernador, estamos aquí para decirte y que escuchen los legisladores que nos vetaste porque crees tú que nosotros no somos indispensables.
Mi nombre es Mirna Arana, tengo 33 años y soy de Guatemala. Trabajo en Guatemala no hay, está muy peligroso. Mi familia ha sido extorsionada y la han asesinado a mis primos y por eso yo decidí venirme para acá. Yo llegué a Estados Unidos hace 16 años. Yo pensé que sí había mucho trabajo, pero me encontré de que lastimosamente hay veces que como venimos llegando de nuestro país, hay personas que nos tratan como una forma inhumana en el trabajo. No pensé que aquí me iban a robar el salario. Pensé que lo justo, ¿verdad? Que iba yo a estar recibiendo mi cheque como yo limpiaba, porque yo miraba que yo estaba muy cansada limpiando mucho y yo así pensaba que así iba a ser mi cheque, pero a la hora de yo recibir mi dinero, mi tristeza era mucha y yo me ponía a llorar y de estar mirando que yo estaba saliendo muy noche de trabajar y nomás me pagaban 6 horas y eso no era, y no podía decir yo nada porque ellos me despedían.
My name is Rock Delgado. I'm from the Philippines, 63 years old, and working as a caregiver. I live in Los Angeles, near to Filipino town. Life in the Philippines is a meager. It's hard to meet both ends together. So I decided to go in the US, but no idea what I'm gonna work there because all I know I am a tourist visa. And mind you guys, I went to the US, I have only $20 in my pocket money. When I came over here, I worked in a facility like say board and care. And would you believe I'm handling 6 patients that time and they will pay me only $40 per day, not per hour. I have to take them shower, have them dress up, sit in the table, prepare their medication and do their breakfast and then, oh my God, I don't know. I myself are asking me how did I do that with $40 a day? I have passion on elderly people. I could see them, my dad or my mom. My patient now is 90 years old, Alzheimer, stage 4. She bite me, she curse me, everything. Sometimes she told me, call the police. I said, okay, I called the police already. And they are coming. And she said, okay, fine. She need attention, she need care, she need love. So I accept all this criticism because this is part of my job. I love it to be a caregiver.
My name is Kimberly Alvarenga, and I'm the director at the California Domestic Workers Coalition. Our mission is to advance the dignity and the rights of domestic workers. We're a member-led coalition, and we achieve our goal through leadership development, grassroots organizing, and policy advocacy. There's a long history of exclusion of domestic workers from basic labor laws. In the 1930s, when we were debating landmark policies such as the National Labor Relations Act and the Fair Labor Standards Act, there were members of Congress that were from the South that refused to support these policies unless domestic workers and farm workers were excluded at the time. It so happened that at the time, those workers happened to be Black workers. And so there's a long legacy of enslavement and racism. It's been over 80 years, and so it's about time that we end this racist exclusion from basic laws and protections.
¡Sí se puede! ¿Esperan ellos a que nosotros continuemos arriesgando nuestras vidas? ¿Qué tal nuestras familias que dependen de nosotras?
Trabajamos muy duro por esa ley, pasamos todas las instancias y cuando estuvo en su mesa el gobernador se negó a firmar porque dice que nosotros no calificamos para tener protecciones de salud y seguridad. Lo único que queremos es tener salud y seguridad para poder trabajar bien en sus casas. Gracias a nosotros ellos pueden salir a sus trabajos. Si no tuvieran que, ¿quién les cuidaría a sus hijos? ¿Quién cuidaría su casa? ¿Quién limpiaría sus hogares?
We're treating this very seriously and deploying significant resources to protect public safety.
A lot of the issues which are not said very publicly because there is no organized opposition to the bill. So it's usually, well, this is the privacy of my home. I don't want an inspector coming into my home unannounced, invasion of privacy. So it's things like that, which really are old arguments. They're very old arguments. They still go back to the days of slavery, as if the domestic worker was someone's property.
So Governor Newsom vetoed SB 1257 at the end of September. Our membership in December got back together and decided that they wanted to reintroduce the bill. And so in 2021, we introduced SB 321, again, the Health and Safety for All Workers Act.
More than ever, domestic workers urgently need health and safety rights. Home care workers, without having the right to know if their clients are COVID-19 positive or not, are still caring for elders in our communities.
Pass SB 321. Pass SB 321. For health and safety protection.
This movement came directly from domestic workers. In 2020, there were domestic workers that we were hearing in the middle of wildfires who were being asked in mandatory evacuation zones to head up to fires, to clean homes that had been burned down, that were full of toxic ash, and they were becoming sick. And it was in that moment when COVID-19 hit. And we also started to see the impact of the pandemic on our members. And in the middle of this pandemic, when domestic workers are being devastated as essential workers and they are feeling the health impacts and the economic impacts of COVID, to not provide them basic human rights in the middle of this pandemic is just unbearable.
In February 2020, I was working as a live-out caregiver in Brentwood. I was attending to the patient. He has a brain tumor and he was hospice already. And I told them already that COVID is surging. Please wear your mask, but they were not aware of that. So we have so many visitors, their kids, their nephews, their grandchildren are visiting us. So I was wearing a mask, but it's not enough. I finished my job there like March 31, 2020. I got sick like April 8. So I went to the hospital. They diagnosed me. It was a COVID-19. Then sent me to the ICU. And I said, oh my God, this is it. This is the end of the world. I got it for my work. Yes, definitely. I told to my friends on the Facebook that I'm dying. I surrender my things. This is it. They diagnosed me that I have a severe pneumonia already. Yeah. And the next day, I was already intubated. I was intubated from April 8 to April 28. I woke up finally and I can't believe it. I'm alive. I survived. So in the hospital, in the ICU, they call me Miracle Rock. Maybe God give me a second life to voice out myself, to convince people. And I hope soon, Governor Newsom, please pass the bill. And lots of people will be protected too. Filipino Worker Center is a non-profit organization that helps, especially for undocumented, the caregiver rights. I joined PwC in 2007, and then after I survived with my COVID-19, I'm very much active with them, doing the outreach, telling the people that please be vaccinated, and it saves your lives. Caregivers are essential workers too. We need to be protected because we raise our lives. Without PwC, I was not able to do this. Now I don't know my rights. Maybe I'm still hiding until now.
I'm Irva Hertz-Pichotto, and I'm the director of the University of California, Davis Environmental Health Sciences Center. During the pandemic, we were hearing how frequently it was that clusters of cases of COVID were happening right around the workplace, raising issues about workplace conditions. The domestic workers were of particular interest because they don't have the kinds of rights that most workers have. Basically, they are excluded from the regulations of OSHA. In a way, domestic workers are invisible. They're hidden away in the homes. So we put together a survey specifically for domestic workers, and we worked together with the California Domestic Workers Coalition to do that, and they also helped to distribute it to their members. When we looked at the data, the results were a bit alarming. 77% of the respondents to the survey reported that they had experienced an employer who had not provided any type of mask for them. In addition, domestic workers were 3 times as likely to report that they had been told by a physician that they had COVID-19 as compared to Californians as a whole. Besides the obvious health consequences of COVID-19, we also all know about the enormous economic burden that this pandemic has brought, particularly for low-income people. And the domestic workers were no exception. The disparities are quite great. About 36% of the domestic workers lost all of their jobs, meaning they had zero money coming in. What I'm hoping for is that this report shines a bit of a spotlight on the problem and the needs of domestic workers for health and safety protections on the job.
Ese día yo trabajé de las 6 de la mañana hasta las como 10, 11 de la noche, levantando cajas pesadas y levantando muebles, porque los inquilinos estaban desalojando y tenía que estar haciendo una limpieza profunda. Yo sentía muy fuertes dolores y yo dije a mi empleador que por favor me dejara salir a las 5 porque yo sentía mucho dolor. Y él dijo, no, pues aquí vinieron a trabajar y ustedes, ¿por qué no quieren trabajar? Y él estaba súper enojado y yo con miedo que me iban a despedir. Y dije, y estando embarazada, yo ahorita necesito trabajar para ahorrar más para mi bebé. Y entonces yo me sentí obligada a quedarme ahí a terminar. Y estando llevando la vacío, yo me sentía como más mal y con un fuerte dolor en mi vientre y en la espalda. Y decidí quedarme ahí a terminar de trabajar. Pero yo llegué sangrando a la casa y ya fui a las 5 de la mañana al hospital, a la sala de emergencia, pero en lo que me iban a atender ya fue demasiado tarde, perdí a mi bebé. Tuve un aborto espontáneo, me dijeron que era espontáneo, pero yo estoy segura que fue por las más de 16 horas de trabajo. Después de que yo perdí a mi bebé, les conté a mis empleadores, pero dijeron que esta fue mi culpa. Y nomás así, fue tu culpa y no dijeron nada más, que siguiera trabajando. La doctora que me estaba atendiendo en mi primer embarazo, yo le conté mi historia y ella me mandó a Mujeres Unidas y Activas. Y allí fue donde yo pude conocer mis derechos y lo que estaba pasando conmigo. Yo vine a MUA porque ellos me apoyaron y decidí quedarme ahí porque yo miré como habían mujeres que les ayudaban ahí. Yo trabajé para esta campaña porque yo quiero que las trabajadoras estén incluidas en esta ley de Calosha y tengan protecciones, las que yo no tuve cuando yo necesitaba.
Because we're still in the middle of COVID, we've continued to organize creatively. We've done all of our lobby visits and meetings with legislators online via Zoom. So our base got really creative and started to use their acting skills to convey the message to the administration.
Así que el gobernador de California se preocupa por la salud durante la pandemia, pero no se preocupa por la salud y seguridad de las trabajadoras de casa.
We've been advocating really hard and creatively on the Senate side. We got through Senate Labor Committee, Senate Judiciary Committee, and also really escalated our presence in Sacramento.
Nananawagan kami sa iyo, Governor Newsom, na ipasa ang SB 221! Sí, sí se puede, sí, 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 sí se puede. ¡Arriba 221!
Si se puede. I don't know what the governor's going to do. I'm hopeful that he gives up. When all these women around him keep saying, sign this, that he'll do the right thing. SB 321 is set to be voted on the floor of the state Senate sometime in this next week or so. I'm very hopeful that we have the votes for it, but we just got to keep at it.
Colleagues, I ask for your aye vote.
Is there any discussion or debate on this item? Seeing none, please call the roll.
Allen. Aye. Archuleta. Aye. Atkins. Aye. Faith.
Ayes 30, noes 10. The measure passes.
¡Sí se puede! ¡Sí se puede! ¡Sí se puede!
We met with the administration, and the governor's office expressed the fact that they were not ready to repeal the exclusion for domestic workers at that time. So we met with members, started to talk about what potential steps that we could take to really bring dignity to these workers and avoid another veto in 2021. So we worked with our committee and our members and developed an amendment proposal, which the administration has agreed to. The proposal was to create an advisory committee that would be made up of workers and employers to create voluntary guidelines for the domestic worker industry. It was a hard decision. The debates amongst membership and amongst our base can be heated. You know, people feel really strongly about their position, you know, and in the long run, our membership overall, a majority, after taking the vote, decided that this amendment would be a first step in the right direction to ultimately give domestic workers the rights that they actually deserve. It's a foot in the door that we're making at this point. Internally, we have 7 organizations that get to vote as a part of the steering committee, and the vote was 5-2.
Nuestra visión era una ley. Desde el principio de la campaña por los años anteriores y este año y los 2 años pasados estábamos una ley que cambie el sistema de las trabajadoras domésticas, donde que esto sea una ley, no sea un arreglo. Y eso fue lo que sentí en ese momento y dijimos, no tenemos claridad que es específicamente esto, vamos a votar que no, pero igual, si alguien tiene y ya más detalladamente vamos figurando todo esto no nos va a causar un desacuerdo a nivel organización. Finalmente entendimos que podría ser bueno y seguimos unidas y estamos esperando que esto sí se llegue a ser una ley.
Me siento decepcionada de no poder llegar hasta ahí, para que seamos incluidas en Calosha completamente, pero nos conformamos en que sea, yo me conformo en que sea con este poquito, va para mientras estamos siguiendo luchando.
I'm personally, very hurt and, upset. But as a legislator, I know that I have to go on. And I made a commitment to the domestic workers that we're going to keep working on this until we get what they deserve. In my experience as a labor organizer for decades, we didn't win everything we wanted the first time. That doesn't mean we failed. It just means that we want more and more and more, as it should be. And we push and we'd win something. We'd push and we win more. We'd push and we win more and more. And that's just part of the struggle. The struggle on any issue, women's issues, LGBTQ issues, labor issues. We always push hard and we win something, and we push hard and we win more. In response to the governor's veto of prior legislation, we have amended our bill to create an advisory committee that will develop the guidelines, voluntary and educational guidelines for protecting the health and safety of domestic service employees.
I'm devastated at the amendments that I know that you can't possibly have wanted to take, but I do understand the position we're in. It is in some part shameful that a bill with no formal opposition we can't convince folks that this is the time to really remove the vestiges of slavery that allow for us to mistreat domestic work.
Bienvenidas, compañeras, a la celebración. ¡Ganamos! ¿Se pudo? ¡Sí se pudo! ¿Por qué no?
¡Yes! ¡Legalización! ¡Comunitario! ¡Vamos por más! ¡Queremos más! ¡Queremos más!
Bienvenidas a todas. Con mucho amor.
Mi nuevo bebé nació el 18 de diciembre y estoy bien feliz porque él ha llegado ese día que cuando a mí me dijeron que yo iba a tener el bebé que aborté, me dieron esa fecha. Ahora mi bebé llega a los 4 años a la misma fecha. Y dije, oye, ustedes, qué bonito. Y me siento muy feliz con mi niño, con los dos, porque tengo 2.
La lucha sigue!
I'm in awe of the resilience of our base and our members, and we're really excited about the future. As we speak, we're working on the next campaign. We're going to be introducing an ordinance in San Francisco, creating and mandating the first ever portable benefits, paid time off mechanism for domestic workers in the city.
Yo me meto en esta lucha por el bien de mis hijos. Voy a seguir luchando por ellos, para darles una vida mejor y que sean unos buenos ciudadanos y que se vayan a la universidad. Ese es mi gran sueño.